This is your host, Laura Winters, the heart-led pathfinder, intuitive energy healer, speech-language pathologist, and owner of Your Light Holistic Therapy and Wellness, LLC. Welcome to Miracle in Time, a mini-series podcast that brings you the stories of beautiful humans exploring the synchronicities, blessings, and miracles within our perception of time. It illustrates that events are not just happening to us, but for us. Life isn't always rainbows and butterflies, but it is a miracle in time. As a disclaimer, this podcast contains general information about various topics and medical conditions and is for educational purposes and inspiration only. Your Light Holistic Therapy and Wellness, LLC is not responsible or liable for the accuracy of information contained in this podcast. The information contained in this episode is the personal views of the host and guests, respectively. This podcast is not meant to replace the advice of your healthcare provider and is not intended to prescribe, prevent, treat, or diagnose disease. You assume all risks when you continue this episode. I am so excited to be able to offer a low-cost healing option for moms out there that are overcome by guilt from medical decisions. I am healing the guilt from making medical decisions early on in my children's life that I honestly didn't know any better. As a result, they have chronic illness, and I am often reminded that they have their own journeys too. Love is how we heal our guilt, and we don't have to do it alone. Join us in Healing Medical Mom Guilt. You can register on the website at yourlightllc.com/scheduling. Since 1984, Greg Notestine has been successfully treating tongue-tied infants, children, and adults, and teaching and lecturing about tongue tie and other oral restrictions, collectively referred to as TOTs, Tethered Oral Tissues. People travel great distances for his care and expertise, and I was honored to speak to him. I hope you enjoyed this miracle in time. Hi, Dr. Greg. I'm so thankful to have you on today.
I'm thankful to be here. I hope we can educate a lot of folks.
Yes. So I met you because in October of last year, I went to a course called Make the Connection, which was a foundations course in myofunctional therapy. And so after that course, there was a cohort of people who are very local to the area came down that next month. I believe it was in November, and you did a short talk on tethered oral ties with Patty Fisher, who's a speech therapist. And it was kind of funny how that happened because there was just this email that came out that said, "Hey, anybody want to come down for this?" And I was like, I don't even know what we're talking about, but I mean, I do called like kinesiology muscle testing. So with things that are like kind of outside of, or if I'm not quite sure about something, or if it like really impacts my schedule, I'm like, do I really need to do this? So I muscle tested that I absolutely needed to do this. So I'm like, I went down there like not even knowing what any of this was about. And, so you did this great talk about tethered oral ties, and so I very much appreciated that. So I wanted to bring you on because a lot of things have transpired since then, but I feel like you are such a wealth of information especially for the state of Ohio. And I would love to get your story and your message out there.
Great.
So
where do you want me to start?
Yeah. So why don't you start with like your background, how you got into the profession that you're in?
I always liked working with my hands. I liked working with people. I'm very much like my mother, that she was a very social person, and I always thought I'd like to be a forest ranger. I love camping. Was I just loved Boy Scouts and started looking into that and thought, I could join the National Forest Service and I could end up giving tours to the Washington Monument.
Wow.
Nah. And I had part-time jobs and I had a lot of really crappy bosses. So I thought, all right, I want to be my own boss. So what can I do? I was in the orthodontist chair for months and months and months as a kid, and the orthodontist walked by and looked in and said, "Yeah, that looks good. That looks good." And all these young ladies were doing all the work in the mouth. "Yeah, that looks good. That looks good. See you next month." I thought, I could do this job. So I looked into dentistry and got into it, and it just fit beautifully with my ability to work with my hands and interact with people on a one-on-one basis. And I've been a dentist now for 47 years, and I've loved every minute of it. And uh, my sister was big into breastfeeding. She had 4 kids of her own. We grew up with a neighbor who was the only woman in the world breastfeeding in the 1950s and 60s. They collaborated, and they had a group of moms in a La Leche League group. Moms got together and helped each other. And they had a child. These 7 women had a 3-week-old baby, this particular mom's 3rd child, that between the 7 of these women, 150 years worth of breastfeeding experience, they couldn't figure out why this kid could not eat. Couldn't do the breast, could not do the bottle. They were ready to put a stomach tube in this child. It had been hospitalized twice for dehydration. And my sister called and said, "Greg, you're a dentist. Can you look at this kid's mouth? Is there anything wrong?" And the tip of its tongue was anchored to its bottom gum. This child could not move its tongue at all. I said, "Well,
Wow.
he's tongue-tied." And they said, "Well, what's that?" And I explained, and they said, "Well, fix it." Me? What we learned in school was a 1-hour lecture on treating the 5th grader that had been in speech for 5 years. You make an incision, you peel away, you put in 190 stitches and hope the kid doesn't die. I can't do that to this child. And they begged me, "You've got to do something." So I pulled out my anatomy book, I looked up the parts. The parts were the same as that 5th grader, only small. So we all held hands, we said a prayer, I got out my sharpest scissors, and I just started making little snips. And the tongue went, whoop. The tongue went, whoop. The tongue went, "Oh God, I'm getting scared." Whoop, whoop. And then all of a sudden it went, whoop. Oh. Kid didn't
Wow.
bleed to death. They put the kid to the breast. And to this day, I'll never, ever forget the look on that woman's face. She had 2 successfully breastfed kids. Kid number 3, her nipples were chewed off because she got no support whatsoever. She went to put the kid to the breast. The look on her face was like, "All right, here we go again." And then she went, "Oh, that's how it's supposed to feel." And the kid ate, got hydrated, everything turned out. And these women just started sending me kids. And that was the mid 1980s. And they would send me one week, 2 weeks, 3 weeks, another, and we just stuffed them into my schedule. And I just was treating them. And one day read an article by Larry Kotlow, a pediatric dentist in Albany, New York, who identified, all right, if the tie is here, it's this number. If it's here, it's another number. That's all it was a classification of where it was located. And I called him and we talked, and I kept treating kids, and they just kept sending them. And they just kept sending them. And I'd stuff them in my schedule and work with them. No pre-op care, no post-op care. We just worked and worked and worked. And the kids ate. Oh my gosh. And it grew and grew. And then we created the International Affiliation of Tongue-Tied Professionals with um, doctors, physicians, dentists, lactation consultants, chiropractors, body workers of all different types from around the world. And we put together this international consortium of folks affiliation. We called it the affiliation. And we started sharing knowledge, and it grew and grew. And from that came the International Consortium of Ankylofrenula professionals. So not just tongue-tied, but lips, cheeks. And now there's a big research arm of that organization, and it's growing and growing and growing. And we're all sharing knowledge and sharing information and helping not only infants to feed, but toddlers we kind of stay away from because it's so difficult to do pre-op and post-op care for them. But I will treat a toddler age roughly 15 months to 3 or 4 or 5 if they're having severe eating problems, severe sleep problems, severe speech problems. We'll treat them knowing they may need to be treated again later when they can sit with a therapist and cooperate. But I treat all ages. The oldest person I ever treated was 92 years old. He had a lisp. His mouth was kind of funky looking, but he grew up, he had a job, he had a family, and until he had a little stroke that affected the muscles he was using dysfunctionally to swallow, now weren't working. So he was getting frustrated. Depression, anxiety, suicidal thoughts, because all he wanted to do was eat, because it was, in his words, the only joy left in life. So he got a little speech therapy, a little feeding therapy. I released his very significantly tied tongue, and he was able to eat solids the rest of his life. So you never know. They come in all degrees of severity and difficulty. So you just never know when it's going to matter to treat a tethered oral tissue, a TOT. So
Wow.
that's my story.
That's really amazing. I mean, it's wild how that just like came, and like the one baby had an issue. Your sister was like, do something about it. And then how that grew over time to, I didn't even know that, to an international group of people. I mean, that is a huge legacy. Wow.
Yeah. I did sell my general dental practice, and now this is all I do is treat TOTs. And it's just a blessing that I can do this.
Yeah. Well, wow, I am really blown away. Okay, so let's go back to like, we're going to kind of hit, I guess, some little age groups if we can. So the infants.
Okay.
So what might be some symptoms that, that there may be associated with infants and a tethered oral tissue?
Most of the infants we see have 4 main symptoms. Painful at the breast for the mom, lose seal and take in air and get gassy, work really, really hard, pull off, because muscles that are working too hard get fatigued. So it's start and stop breastfeeding, and poor weight gain. Those are the main ones. But within that are poor latch, can't latch, lose latch, frustration, tense body. Those are the biggies.
Yeah, so many things. And it goes back to this like, obviously they need to eat in order to survive. And so when these tissues are tight, the tongue, the lips, the cheeks can't function the way that they're supposed to. And so when a release happens, now there's that movement, that there's more mobility to be able to have that function more appropriately.
Right. And the muscles, our brain, we got this IT thing in our head. When something doesn't work, we instantly compensate. So if you can't do it right, other muscles kick in, and then those muscles overwork while the muscles that should be working underwork, so you have this imbalance. But you may be getting the job done. So kids that can eat, okay, they're getting along now as an infant. Now we go to introduce solids, and these muscles that were overworking, holy cow, they're not working now. And these that are underworking aren't participating. So we see another wave of kids when it's time to start solids. So the
Exactly.
brain compensates unbelievably.
Yeah. And I think about my second. Now, my first had trouble feeding, and within the first let's see, I had to do a nipple shield at the hospital in order for him to latch. And then I worked with a speech therapist online and got him off of that. And then my second son, he fed just fine. But then when we started introducing solids, he started coughing a lot. And I'm an adult speech therapist. So like, I'm like, well, he's not aspirating. I'm sure he's okay, you know? But like now with the information that I have, like he is very tongue tied. And I'm like, oh my gosh, all this stuff makes so much sense. But I didn't know any of that back then.
You didn't know.
Mm-hmm.
We hear that every day. We didn't know. It's not in the baby books. We don't learn it in medical school, dental school. It's all out there though. And we just got to keep educating.
Yes, for sure. So then, how about, so you said not really toddler age, because yes, I mean, I can think about my daughter right now, and she doesn't want to do anything that I tell her to do. And most of the time does the opposite of what I tell her to do. So I can see how that can be very tricky. And so then how about school age? A little bit older kids.
When a child is old enough to be able to sit with a therapist one-on-one and do repetitive exercise, stick your tongue out, move it side to side, lick those Cheerios that they put on the string, all those things that those therapists know to do, when they can have enough attention and build that muscle strength in the right way, then releasing the tension in a tie then has a much higher chance of success. So, are you cooperative at age 3, age 4, age 5? I don't make that determination. I let the parents and some degree of therapist say, yeah, we can work with this child. So
Yeah.
then we have a much higher chance of success.
Yeah, that's a really good point in that it's not just a come in, look at it, release it. There's a lot of work that needs to be done ahead of time, or at least some work that needs to be done ahead of time for it to actually be a success.
Yes. And then a little work afterwards. Nobody goes in for example, a knee replacement without getting a little physical therapy first. All right, your knee is supposed to move in this direction when you walk. So let's work, even though it hurts now and you can't do it, let's strengthen those muscles a little bit. So now when you get your new knee, it knows where to go.
Yeah.
I've made the mistake many times early in my career of just releasing everybody I saw, and the tongue may be then all over the room because the muscles and the brain connection to the muscle doesn't know what to do. It builds the wrong muscle memory.
Yeah, that makes a lot of sense. And then I think about my adults that I see and the swallowing problems. And I like that you had mentioned about your older guy with problems swallowing, and that his swallow was dysfunctional beforehand, but because we are just so amazingly made that we compensate. And so when those compensations then become impaired, then there's a complete breakdown of the system.
That's exactly right.
Yeah. And so I experienced that with my own patients. You know, they never had any problem swallowing before, and then they have a stroke, and then their tongue didn't move the way it did. But then you look in there, not with the knowledge that I have now, and I go, that probably never worked right in the first place.
And that person has absolutely no idea what normal, proper is because they've never experienced it. To them, what they
Exactly.
do is their normal.
Mm-hmm. Yeah, for sure. And I don't want to talk about this right now, but yeah, even in my own experience, my own journey, which I do want to talk about, but I had some of that as well. So I'm just very, very thankful that we crossed paths. Now, I want you to explain the surgical procedure if you can.
Okay. If you think of a chicken wing, you go spreading those bones apart, there's webbing in there. Well, you can only stretch that webbing so much. So the surgical procedure involves just cutting through that webbing so the chicken wing bone can spread apart. Well, in the case of the mouth, it allows the tongue to be able to elevate with less strain or no strain and go where it's supposed to go. So we cut through that, and it makes a wound that goes whoop, and it's kind of diamond shaped. And that wound has to be stretched. Otherwise, it wants to heal. Every wound you have in your body, the scar contracts. Doesn't matter where in your body it is. Well, we're going to mess with Mother Nature and keep that wound long and open. It fills in with scab, so we cut through that, and then you got to work that wound. So we open it up, and it just opens. You can imagine taking a rubber band and stretching it, and then somebody cut into that rubber band, it goes whoop, like that.
Mm-hmm.
So that's the wound we make. Now with infants and young toddlers, we just leave that wound open because it's not very big. Because it opens flat and very shallow, it's not much different than a large canker sore. It's kind of raw. You don't want to pour any grapefruit juice on it that first day. But once the scab forms, then it's like the scab on your knee if you skinned it. It covers the wound and it heals from underneath. Now, because it's in your mouth, the wound is wet. The scab will be soggy and white and soft, but it's still a scab protecting the wound. So the job of the caregiver, whether it's parent, babysitter, grandma, whoever, has to stretch that wound, and we teach them how to do that. So that when the new frenums form, that's what you call these parts, frenums, frenulums, you want to help them be as long and flexible as possible. So you got to work the wound, whether it's fingers in the mouth by the caregiver or the person themselves doing their own motion to stretch.
Mm-hmm.
So the wound is made. I will put sutures in the wound if it gets really big, it opens up, and then we bring the sides together to help promote early healing. But as those sutures, stitches dissolve, the wound will open up a little bit widthwise, but it's full of scab by now. So then it heals, and after about a month, the scab is gone, but it's still healing underneath for many months. So that tissue has to be worked, stretched over and over and over to keep muscle that has never literally moved that far. That muscle has to develop new length, new flexibility as the person develops new everything.
Yeah, for sure. And I think that it looks so ugly when it's done because it's open. But yeah. What in your experience do you have, like, I think as a parent, when they suggested this for my daughter and I did not pursue it, I was in a total anxious state. But I was like, I don't want to inflict any pain. I don't want her to be in pain. I don't want negative side effects. I don't want, like, what do you find in your practice of concerns or feelings like that? Especially for the young kids.
Yeah. Nobody wants to put your child through surgery. So we spend a lot of time talking about the emotional aspect of this. Many moms that are struggling with breastfeeding have many, many negative emotions every time they put their child to the breast. So they're already high strung. All those bad chemicals in their body are flowing all the time that affect milk production, affect milk release. So they're already highly stressed. So now we're going to tell them, all right, now we're going to cut your kid. oh my gosh, emotions can go out of the roof. So a huge part of my job is explaining what I do, the benefits of it, and how things potentially can be 1 day, 2 day, 2 weeks, 2 months down the road. And we must help the parent or caregiver, whoever's with the child, understand that, yeah, there's some stress involved here, but you can get over this. So explaining that the wound I make, because these tissues they're webs, they're webbing that did not dissolve away by the 12th week in the womb, a process called apoptosis. Look it up. But it's webbings that form and are supposed to shrink away. You may have seen kids with webbed fingers. That process did not happen. When it doesn't happen in the mouth, it results in parts that can't fully move because there's webbing in the way. So we cut through the web. That web is not much more than a bad hangnail. There's not much nerve in it. There's not much blood vessel in it. So when you cut a hangnail, it's like, oh, but then you're done. Now don't stick that finger in lemon juice for a while. Or a bad cheek bite. Oh, wow. Or a little pizza burn. Well, it's irritating. And that's about all the deeper the wound is. So I have to help the parent understand that. What will bother the child almost more than the wound itself is the new freedom of movement that the child doesn't understand. I'll tell the parent, all right, your child, you've seen their tongue. Some of them can get it out to the gum, some out to the lips, some it comes out a little further depending on where the tie is. Now the tongue's going to move where it's never been. The child may be laying there doing nothing and move the tongue where it's never been and surprise them. And they may have emotional outbursts for a few days. Literally, there's a foreign object in their mouth that they don't understand. Another aspect of those early days of healing, muscle that has never moved, literally never moved since the first month in the womb when these parts started forming. Now that muscle's moving. Well, that muscle's going to get sore. How you feel tomorrow after, for example, a new exercise routine or moving boxes or furniture all day. You have muscle soreness. So the child will have a little muscle soreness in their face, jaw, neck, tongue. That's going to make them kind of cranky. So you got sore wound, sore muscles, flopping tongue. Expect your child to be fussy. And you, mom, you, dad, you, grandma, must show a positive outlook. They read your emotion. And if you're high-strung and wired, they're going to be high-strung and wired. So when you see your kid fussing, you got to smile and be happy and say, oh, cool, I see your tongue, wow. And help them emotionally understand all this change is okay. They'll learn to accept the fact that you got to stuff your fingers in their mouth and stretch that wound. They're not going to like it. Nobody likes fingers in their mouth. They're going to fuss. I say, does your child fuss when you wipe their rear end with a cold wipe on a cold January morning? Well, yeah. You're stimulating their nervous system in the way they don't like. Because these wounds are so flat and so shallow, you're really not hurting them when you do the stretching therapy, but you are making them angry. So smile, sing a song while you're doing the therapy that'll help them accept the fact that, yeah, this is part of my day.
Wow, that's a really great perspective. Yeah, I mean, that's totally not what I had in my mind as I was going through it, but you do have this great calming voice, and this, just everything that comes through is just like, oh, okay, that makes total sense. You know, you've been doing this for so long, right? I mean, you've had to perfect that over the years.
Yeah, I'm blessed to have my mother's personality. She was always a people person. So it worked great for this job.
For sure. So, what are some things? So, let's go to the adult population. So, what are some things that the adults might experience needing or like have symptoms of that may require a look see at a tongue tie or the other ones?
Well, we can start with the dysfunctional swallow. If your tongue can't do what it's supposed to do to move fluid, solids from front to middle to back and swallow it, muscles will compensate. And a frequent thing we see is you move your whole head, and we swallow our own saliva anywhere from 600 to 1,000 times a day. So when you dysfunctionally swallow and overuse muscles over and over, by the time you're age 20, 25, 30, 35, 40, that takes a strain. So most of the adults I see have some degree of discomfort in their neck, jaw, shoulders, neck, back. They see the chiropractor, they take pain medication, they get their TMJs worked with, and they're not getting relief. So almost every adult I see has been through lots of different modalities. Somebody decided that, hey, maybe you've got tethered oral tissues. There's a place in California called the Breathe Institute, and they've got everybody on site. And they came up with a little kind of screening tool where they have people open their mouth wide and just lift their tongue tip and get an idea how close it is to the roof of the mouth. If it's 100% to the roof, you're probably in good shape. If it's 70%, 50%, you got problems. Less than 50%, you've got a real problem. And that's for the front of the tongue. For the back of the tongue, you close your teeth together and then suck your tongue up into the roof of your mouth and keep it there. And now open your teeth. And when you're in good shape, your mouth opens pretty far with your tongue still up there. If you can only open this much, the back of your tongue isn't doing what it's supposed to be doing. So just looking at this screening tool, we get an idea that a person might have some restriction in there. Mm-hmm. With lips, it's for an infant, it's how well can you flare the lips to be able to get a seal to stay on the breast or the bottle. With older folks, that may be more a gum problem than it will a functional problem, but we get them out of the way, then that may not then be an issue the rest of their life, or the lip creating a gap between the teeth if it's anchored all the way down and prevents the teeth from coming together. But most of the issues with adults are the tongue. So it's headache, neck ache, backache, posture. Like right now, if you're watching this, listening to this, and you're not eating, drinking, or talking, your tongue should be up in the roof of your mouth. And if it can't get up there, out of your airway, it can make a problem. So if you've ever taken CPR, when they tell you to elevate the jaw to open the airway so you can get the breaths in, people will do that automatically, compensate. They'll move their chin forward. And when you do that, you can bring your head forward. So now you got posture problems. And how do you keep from tipping over? Well, you throw your hips forward. So now you're a mess. So you got neck ache, back ache, shoulder ache, hip problems, knee problems. So those are the things I see with adults. Another part of it is fascia. It's that gooey white stuff that holds us together literally from our mouth all the way to our feet. If you take apart a chicken leg and there's that white filmy stuff that's between all the muscles that covers everything in our body. And when it's tight somewhere, it can show up somewhere else. So I see it very frequently when it's tight in the mouth and I release it, the first place it shows up is the chest, neck, and shoulders. People get up out of the chair and they go, wow, I could never turn my head that far. What did you do to me? We loosened fascia. Fascia. Look it up. And that goes all the way to the top of our feet, the back of our feet. We
Yep.
had one gentleman that never walked with his heels hitting the ground. He always walked on his toes. He had therapy. He wore braces 3 times. His teeth kept going back where they were. We released under his tongue, loosened that fascia. He got up out of the chair and his heels hit the ground. Scared the heck out of him. This was before I really understood the role of fascia. But now that we understand it, and now there's fascia therapists out there that help loosen up people's tight fascia. We're understanding it more and more and more. But the adults I see, mostly it's chronic pain.
Yeah. So 2 years ago, I think it's been 2 years now, I went to a training course called Craniosacral Fascial Therapy. It's called the Gillespie approach. And they included in that training is also a piece on the tethered oral tissues, tethered oral ties. And so I've been doing that therapy myself in my practice, and it's so important. The fascia is just, it's so amazing. And so let's talk about me now, because when we had this initial talk, you kind of just did a quick look-see to see what everyone's issues were, which was so helpful. And then I remember me or somebody else saying oh, hey, we should just all come down together. And so I just let that go. And then I found out, hey, maybe we really are doing that, which was such a blessing. So anyway, I was man, I really need to do this, because all these things that you're saying, the shoulder, the neck, the clenching, and looking back, I mean, I would say probably only 40% of my tongue was able to hit the roof of my mouth. I knew from that education and stuff that that's what I needed to be doing, which I had never done before. My tongue was always on the bottom part of it, was always in my lower jaw. And so it was just wait, this is just an opportunity for me. I have to do this. And it's funny to kind of tell somebody that you're going to do it, because they're that's just for babies, right? You're obviously eating fine. Well, yeah, I mean, yes, I am. And surprisingly enough, I would say probably 6 months before, I started having more dysphagia problems. So I would have food go down the wrong pipe, and I'd be this is what I do for a living. So I'm there's obviously a problem here that I need to fix. And so I was I wonder if this would actually help with this as well. So for me, coming into and learning about the tongue tie was okay, I'm hoping it can help with neck, with shoulder. I have a forward head position. Maybe that can help with that. The tongue can actually go to the roof of my mouth. Maybe I can swallow better, all these things. And so on the drive down, because I'm 2 hours away, on the drive down, I was very much well, wait a second. Is this something that I need to be doing? Because I trust that my body is just a beautifully designed. Is this just out of control? And I just felt a little uncomfortable, and I was you know what? There's gonna be a moment when I'll just know. And so before you got started, you came out and you said, "Are you okay if we say a prayer?" And I literally, all of my anxiety, everything just melted away. And I was this is exactly where I'm supposed to be. And this is what I need to be doing. And I had never seen the procedure or anything before. And it's just amazing to witness. Like you said, that you have this tight tissue, and the idea that you have when you say you're going to laser it is this beaming light that's coming down. And I'm how does that even just stop in at one position? So it's it looks like kind of a little pen that you just kind of do. And then like you said, you kind of use some scissors as well. But going from tight to released was you just see the moment and you're oh my gosh, that's so wild. And with myself, after I got up, it was like almost an immediate, like, oh, that just feels so much better, you know?
And you felt that immediately.
Yes.
Isn't that cool?
So cool.
Wow.
You know, and for the next week or so, it just I felt so much better. And then like stressors came back in, and it was like, and I've been working with a friend to release more of the fascia to make things better. And prior to, I did like a month of exercises to prepare, and afterward you have exercises and things to do after. And I can totally see what you're saying when you talk about the infants, and that the wound itself, like I don't feel like my pain ever got higher than a 5 out of 10, and that was like as the anesthesia or whatever, the injections was wearing off. Every other time was just like a 2 out of 10, which to me was super shocking, because again, I'm under this assumption that if I was going to do it for my daughter, I'd be inflicting all this pain on her. And for myself was like, oh, it wasn't too bad. And then doing some of the exercises and feeling, and that makes a lot of sense, these muscles I had never used appropriately before. So now they're being worked, and now they're fatigued and tired and sore. So all of that makes complete sense. And I have to say that, it's probably been a good 2 weeks where I haven't had any problem swallowing whatsoever. And to me, that is just like mind blowing, because I think about my adult clients or my adult patients, and I go, man, I am sure over and over again, I missed the boat. I was able to rehab their compensations, but we didn't actually get to the root of the problem.
Well, you didn't just miss the boat. You didn't know the boat was there.
Exactly. Had no
So,
idea.
yeah, we've got to help people understand that this exists, and then get them to folks that can deal with it, or learn to deal with it yourself. And that's a personal goal of mine, is to educate as many people as I can to recognize it, and then learn to treat it. So boy, then I can retire with a happy, relaxed mind.
Absolutely. That you're passing on this beautiful gift to someone else, or a lot of other people, to be able to continue your legacy, which
Yeah.
sounds amazing.
Well, I'm just blessed to have the skill and the talent and the desire. So that's where I am.
Yeah. Have you come across any significant complications, um, that, because people think, what are the pros, what are the cons? Are there potential complications, and what are some things that you've heard of or experienced?
Any surgery has potential complications. In the mouth, there's blood vessels, and nerves that are in there. Most of them we know where they're supposed to be. And so far in my career, I've left one tip of the tongue numb. So far, I haven't hit a big nerve. I haven't hit a big blood vessel. Occasionally, I'll get more bleeding than I'd like. And so far, we've been able to control that either by cauterizing the bleeding spot, either chemically or with turning up the power on the machine, or dabbing it with a chemical cautery. So far, I haven't had big issues. Now, unfortunately, the word is out there, all right, get a laser, you can start treating tongue ties. So some people get a little carried away, the wound is way bigger than it should be, or they're just not aware of the anatomy of the parts that are in there. So damaging nerves and blood vessels are the biggie. We call it tongue tie because the tongue is anchored, but we don't actually deal with the tongue itself. It's the saran wrap under the tongue in the floor of the mouth It's that little tight thing under the lip, the little tight things under the cheek, and there's not much there. So we get through that and allow the muscle to be free. So my wounds go to the muscle. Very rarely do we ever cut any muscle fibers. Occasionally in an adult where the muscle is so short because it's never moved, I'll cut a few muscle fibers to loosen it up. Well, then that muscle has to heal. So that adds a little more soreness. But it's the nerve and blood vessel damage that we've got to be aware of.
Mm-hmm. What is this term that they say to have it grow back?
When we open it up, one of my colleagues said we free it 150%. We know because of the way things heal, they want to contract. So we know it's going to heal down somewhat. Your goal is to prevent it from healing very, very tightly. And in my personal experience, I retreat, or the word we call is revise, about 5% of the folks I see because it healed down too much. So you end up with a scar that's too short. So now we have to cut through the scar, which has now grown blood vessels into it. So they tend to bleed a little more. They're a little tougher to feel, but we've got to get it back open so it can heal longer. And there's 3 reasons why, in my experience, I've seen that happen. 1, the caregiver didn't be thorough with their home care exercise. The second one is the child didn't move their parts themselves. Most of the time I'll see a child cry and they lift their tongue this much. After we release it, now it's lifting like this. But some kids never move it any more than they could. And that position is there 99% of the time. So it's going to heal. It's like they almost put a Band-Aid over it to help it heal. So the child, the person has to create movement and become part of them. And the third reason is some people just tend to scar. They get keloid-like scars that are tough and thick and they heal pretty quickly. And I can't predict any 3 of those. So I do give the folks that are doing the therapy, whether it's a caregiver doing it for an infant or the person doing their own therapy, you must be faithful with it, or you may end up back here and we have to do it again. Nobody wants to hear that. So that's a heck of a good motivator.
Absolutely. Yeah, no. Yeah, that's interesting that you mentioned the scarring and like the keloids, because that was a question that was kind of in my head. Is that something that could happen? I am so excited to be able to offer a low-cost healing option for moms out there that are overcome by guilt from medical decisions. I am healing the guilt from making medical decisions early on in my children's life that I honestly didn't know any better. As a result, they have chronic illness, and I am often reminded that they have their own journeys too. Love is how we heal our guilt, and we don't have to do it alone. Join us in Healing Medical Mom Guilt. You can register on the website at yourlightllc.com/scheduling. So one of the big things that I hear about is that probably more in the speech therapy world, that we see people or kids or whatever who has been released and they're still very tied. And it may be because it may be those complications, but it also may be related to, like you said, sometimes these providers just get a laser and they just do what they do. What are some questions? What are some things that a parent or a client patient may ask to providers that may give them some more information if this is the right person for them?
You mean if the therapist is the
No,
right person
the doctor, a release provider. So like you
Oh,
go in and you're like, I don't know. I just know that they do it, but what are some questions that they might need to ask to know if they're the right person for them?
You could ask, how many have you done? Have they been successful? What are your complication rates? Who do you then send them to, or who sent them to you? So that's where a lot of the confidence comes from. If they are aware of a lot of people that sent folks and they had success, and that's really a challenge when you're becoming a new provider because you don't have much history. So you've got to build the confidence that, hey, I'm kind of a rookie, but I'm building success. I've learned, and now I'm treating folks. Um, but that success rate and where are they coming from and who are you sending them to? Those are the biggies. Those are the real biggies.
Okay, good. Um, so because this is a podcast about miracles, do you feel like along your journey you've had any like miraculous things happen that were just like you just knew? Obviously, I think that first story was like that person, that little infant was like divinely led in your path for a reason, clearly.
Yeah.
But anything else that you were like, wow, that just it just came together, or anything that comes to mind that was just like, oof.
Two things. First one, I played baseball as a kid. I hurt my elbow in high school. I had it surgeried way back, and I got along great for 40 years. And then arthritis started setting in, cartilage damage, and it came to a point where I could not hold my dental instruments confidently without pain. So I got down on my knees and said, okay, God, what are you going to do with me? And a lady walked in my office and said, I'm looking for a practice to buy. Is there one in this area for sale? So I sold my general dental practice and focused on TOTs, which I can hold my laser, I can hold a suture, I can't comb my hair with my right arm, but I can do this treatment. So it's like God was looking out for me and pointing me in the right direction.
That's amazing how, like who would have thought that someone just randomly comes into your practice and is like, hey,
Yeah.
I mean, that that's so God right there. That's
Yeah.
nobody else.
I knew this woman briefly. I did the general dental practice residency at our local hospital, Miami Valley Hospital. And then she was a resident much later, but I was lecturing to them on cosmetic dentistry and treating ties. So she knew of me, she trusted me, so she came to me to ask. So it wasn't 100% totally random, but the timing of it was just so bizarre.
For sure. Wow.
And another story, I do this, I treat TOTs volunteer at a clinic in downtown Dayton, Ohio, called the Good Neighbor House. It's a clinic, medical clinic, dental clinic, and a food pantry for the underserved. And when they found out I do this care, the lactation folks from all these county and clinic places said, oh my gosh, we need help. They can't pay for it. They blah, 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 blah. So I started doing that only. Previously, I was doing general dentistry. I'd go there in the evening after my work hours in my own practice one day a month, and I would do general dentistry. Well, then I just started doing mostly just tongue ties back then. And families would drive from 2, 3, 4, 5 hours away to come get care because it was covered by their Medicaid or their care source or whatever. And one night there was a family in there and the dad was just fretting ridiculously. He said, you cannot put your fingers in my kid's mouth because he's gonna gag. He's gonna, I'm just so afraid he's gonna choke to death. I said, well, sir, I got to put my fingers in his mouth. If we're going to help him. And then I told him the story of my own child. My 20-month-old son was sitting at the swimming pool on the first nice day of summer, eating little pretzels, and he got up and ran. Pretzels went in his airway, and he choked to death and died. We had him, they got his heart going again, but we had him brain dead for a day, and then he died. And I had to pull this dad aside and put my hands on his shoulders, and I said, "Sir, here's my story. I am going to protect your kid's airway with every fiber in my being." And this is making me tear up a little. And then he said, and we drove 4 hours to get here. Now I know why we were sent here.
Ooh, that's a lot.
That's a
Man,
lot. But it's little things like that that keep me going. Man, when I can help somebody physically, when I can help them emotionally, wow.
yeah,
How am I ever going to quit doing this?
right? I mean, the impact that you have is just so much. And I remember when we were in your office and you were taking someone's blood pressure, and I tried to ask you a question, and you were just like, just kind of put your hand up, just wait, just wait. And I was like, oh, that's interesting. And then after you were done, you said, okay, what's your question? And I sat down. I didn't get it. And then when it was my turn and you took my blood pressure, and it was, you have a healing touch. You're a healer. And I felt it. You know, like you had my hand, you're taking my blood pressure, which is something that every doctor or whatever they do, they take your blood pressure. But in that moment, you were centering yourself. You were bringing like healing energy and love to the moment, whatever it was. I was just like, wow. You know, I don't know if anybody's ever said that to you, but it really was like, there wasn't any of all this stuff going on in the moment. There was nothing, there was no room for anxiety or whatever. It was just like you and I in that moment, just so healing. And I was like, this guy is just a beautiful human being, you know?
I guess I feel that. People don't verbalize it. And I can tell you, you get these anxious young parents, especially when it's your first child, and you don't know anything. Oh my gosh. And we go through explaining, and I show them, and oh yeah, now I understand. And then I always ask, is it okay if we say a little prayer before we start? And so often you'll just see their shoulders drop and anxiety just disappear. Only 2 times in my whole career, somebody said, no, we're not praying. We're not bringing any voodoo into this, blah, blah, blah. So I go ahead and say a little quiet prayer myself. But I guess there's something to what you're saying. That sense that comes is part of the healing process. When we're all full of negative hormones and anxiety, and our sympathetic nervous system, that fight or flight nervous system is fired up. When you calm that down and bring in the parasympathetic nervous system, the rest and digest part of our nervous system, things heal better. We just know that. So stress and anxiety are just bad all the way around. So if I can help turn that around, oh my gosh, it just promotes healing so well.
Yeah. And like your experience that you just talked about with your son, I mean, I can't imagine the pain and what that does to your nervous system and just your experience in general. But, we all have the experience that we do, and that it's as big or as little as we make it, but how that created some kind of wave for you to change in a way to be able to just bring this beauty to so many people, you know, even if it's just that calming voice, that calming touch. I mean, I just see chaos turn to something different, you know? And
Yeah.
yeah. So I always say that like these most challenging experiences that we have provide us the highest growth and the deepest connection, and you know, there's not something we ever want to experience, or there's truly a purpose, there's truly a plan that is way greater than what we are and what we know. So I thank
Yeah.
you for sharing that.
Oh, you're welcome. Yeah, and I tell people that experience of losing your child, I mean, boom, he was gone. I have a great niece who was born with a brain tumor that she lived with for 10 years. And the stress and anxiety of everything her parents and her twin sister experienced was so different. For me, it was boom, done. But it made me appreciate life, knowing how quickly it can be over. So it made me a better person. It made me a better neighbor, a better coworker, a better parent, a better husband, because I know it can be over in a flash. And little things don't bother me. It's like, what? So the toast burned, big deal. And when I can convey that attitude to people just by my actions and my presence, it's made me just a better person to be around. And that's so wonderful. What a great gift.
Yeah. And you're able to spread that to others, and that spreads to more people. So you just have no idea the waves that you're creating at all times.
Wow. Yeah. It's one, as Mother Teresa, the great saint who took care of the poor, said, we all can't do great things, but we can all do small things with great love. Pretty simple,
Yep.
just not easy.
Exactly. Exactly. Yes, love is the ultimate thing. That just
Yeah.
absolutely. Anything can be healed with love. We just have to be able to find that love to be able to
Yeah.
give to others, you know?
Yeah.
Mhm. Well, I thank you so much. Let's go to the final question. But what advice do you have to help others see the miracles in their life?
Love and trust the God in your life. And when you can trust and just turn things over, because we can't control anything. So just, and I say this frequently to people when they say, gosh, I wish I knew, blah, blah, blah. I just say, shut up and listen. And God's not going to shout in your ear, but in some way, answers will come. So just be still, be quiet, and listen. And good things can happen. Not in your
Absolutely.
time. Dang it. We want it all right now. Especially in our social media culture. I want everything right now. You got to be patient and just let things happen and let other people in your lives, and good things can happen.
Absolutely. You got it. That's that's exactly what I think too. I love it. The trust is huge. It's so huge. You know, and when
Yeah.
we surrender, we give over that control to God, to whatever you believe in. Oh man, there's so many beautiful things that can happen. Hmm.
Surrender, that's a good word. I like that.
Hmm. Well, Dr. Greg, so where can people find you if they would like to connect?
They can contact me through the office I'm working in at Pedz, Pedz Dental And I'm also working at a place called The Well, a wellness center for women. It's in Kettering, Ohio, and you can go to their website, and they put together a beautiful website, and I see infants only at this place one day a week. I pack up my laser and take it over there, and they have doulas and midwives and lactation consultants and counselors. They have everybody associated with mothering and childhood and women wellness all in one place. So they've welcomed me into there one day a week, which has been really good. The Well.
Very cool. I love that. That's so great. And I have to say, I love the experience that I was able to have, because I came home and was able to say to my boys, you both are getting this done. And to be able to see what I was doing and saying, it's not that bad. So this is not the last time that I will see you, because I'm confident that I'll be bringing both of my boys down to see you. And I'm looking forward to that. But thank you, Dr. Greg, so much for talking today. This was a beautiful conversation, and I'm so excited for the information that other people learn from this, and then your waves of love just keep continuing.
Great. Well, I'm just so blessed and honored I could be with you on this.
All right. Well, you have a nice day.
Okay, you too.
Thank you. Thank you for listening to Miracle in Time. If you would like to explore a theme or know someone perfect for this podcast, please fill out a form on yourlightllc.com/podcast. If you would like to learn more about my services, you can visit the website at yourlightllc.com. I want you to remember that with all life's ups and downs, you are divinely held and guided throughout your journey. Don't miss out on this miracle in time.